Hello, everyone. This is Dr. Valerie, and today I want to talk a little bit about my story and what makes me be a dentist who actually can relate to patient. I can put myself in their shoes. I can understand them. The reason why I can understand you is because of someone who has experienced dental problem is because I too have experienced a lot of problems. In fact, there are many types of dental intervention that I did benefit from that makes me understand, where a person who are experiencing dental problem may be coming from. So I was born in Belgium. I'm from the Democratic Republic of Congo, but I was born in Belgium, and my parents were studying there. I remember in a school trip where going to the dentist and having, dental cleaning, but I can't quite remember going very often. However, we moved and went to the Democratic Republic of Congo. It used to be called Zaire at the time, when I was almost 8 years old. And so when we went there, my dental journey really is such that we didn't really go to the dentist. We went to the doctor if we had issues. We went to the dentist if we had issues. So I remember going to the dentist. In fact, the dentist was one of my aunts. She was my uncle's wife, and she was a dentist. And so I went to see her because I had a tooth that had a cavity. So we wouldn't go on a routine, right? And so just when we had problems, that's when, we would go to the dentist. So at that point, there was a tooth on which I had a cavity, and then I ended up having a dental restoration. I can remember till this day the smell of that particular restoration and the material that was used. I can even remember that smell to this day, and I can also remember like the sound, of the instrument that were being used on the people. I can remember, people being so stressed out, kids, and some people that even had like swollen faces that were going to see the dentist. It was in a university setting, so at the university clinic and the hospital of the University of Kinshasa, which is the capital city of Congo. And I remember, seeing kids and seeing people, that had dental problems. So that, I had my restoration. But a couple years later, I ended up having that tooth ended up the restoration. I guess maybe the restoration fell. I don't know, but I remember having to have that tooth extracted, and it was a front tooth. So I had that tooth extracted. I was a teenager. I believe I was about 15 years old, and that is when I had my tooth removed, and it was a front tooth. So you can just imagine, a teenager with no tooth in the front. And I was like that actually for a couple of years. It's only when I was about to come to the US after graduating high school that coming to the US, I was about to come to the US. So my father took me to a dentist who would now create a dental bridge for me, which is a type of restoration, replacing a missing tooth. So I had a dental bridge done, and that was a few days, before I actually came to the US, that the restoration was placed, and then I came. And I can remember when I had that restoration, I can remember that it was a little lighter than my own teeth. And I always wished, if I were a dentist, I would have done it, I would have created something that was the color of my teeth. And when I look at it now, it's like, yeah, right. You would not have been able to, because even a dentist needs a dentist. So there are some things that you can do on your own, but there are definitely some things that you need a dentist to do, even as a dentist. So yes, it was like that. When I came to the US, I didn't go to the dentist, honestly. The only time I actually ended up at a dentist was when I was in dental school. Can you imagine? So, this lack of information is something that's very, very, very detrimental, right? So I had experienced that. It's when I went to dental school that now, we started being educated about what to do, how to render treatment, and all of that good stuff. And that's when I would now, embark on this journey of routinely going to see a dentist. So, needless to say, when I was in school, I now was able to do so many different things. I was able to get some fillings. I was able to get some cleanings. And I can remember, the first time that a dental cleaning was done here in the US, I had a lot of hard plaque. Obviously, because it had been years since I had not gone to a dentist. Right, so I had a dental cleaning. I had the tooth restored. Actually, I had asked a dentist to actually remove the dental bridge that had the different color, and then I wanted to get an implant. So I had an implant. I got an implant. I've had fillings. I've had an extraction. I've had an implant. I've had a bridge. What else? When I was in school, so I had what you call a gummy smile. So my teeth had not fully erupted. That part of my teeth were like hidden underneath the gum. So I had, that procedure done to reveal actually the actual sizes of my teeth, and that changed my teeth tremendously. I've had tooth whitening. I've had so many different types of a treatment, right? I had an implant fail. I've had a root canal because one day I was unloading my groceries, and I hit my teeth on the car, and years later, or maybe months later, when I was actually in England to one of my cousin's wedding, we're taking pictures, and I noticed that my tooth is kind of gray, and I'm like, what's going on? So when I came back to the US, I asked for an x-ray, and yes, there was an infection on the tooth. So I ended up having a root canal there, So I've had a flipper, which is like a little denture whenever, the bridge was removed, so that it can temporarily replace the tooth. So I've had that feeling. What I say, I've had orthodontic treatment. So I've had braces before to kind of straighten my smile. So trust me, like when you say something like I understand, I've had crowns. So I've had different types of treatment, and I understand what you're going through. I've been numbed before for the treatment. So I'm not your perfect being that cannot relate. I definitely relate, but I'm here to tell you that, not going to the dentist is very detrimental. You can avoid all these things by actually going to see a dentist on a regular basis. But if you are that person, no matter what type of treatment that you need, try to find a compassionate dentist, somebody that can understand you or relate to you. Maybe not, by experience, but I can actually put themselves in your shoes. That's going to go a long way. Well, that was kind of like my story. I just wanted to share with you that I'm not like this person that has never experienced any dental issues. I actually have, and that's the reason why I can understand you. So how I didn't neglect, even though I came from a background where I did not, go on a regular basis. But then once I got informed and got the information about the importance of dental treatment, of dental routine, then I'm starting to follow through. And then, one thing that did not happen to me, obviously, because I'm still alive, but in our family, my mother's brother actually passed because he had dental infection. So yes, you don't want to be that person. You definitely want to go on a routine basis, but try to find a dentist that can actually relate to you. If you're one person that's very anxious, try to go beyond that, because you can end up creating so many other problems for yourself, right? So that's what I wanted to share with you. I just wanted to share my story with you today. And yeah, if you're looking for a compassionate doctor, I am a doctor that's very understanding and compassionate. I try to relate to patients, and I'm not just saying that. Honestly, if you thing that I'm just saying, that you can always visit our reviews. You can go on Google, type Healing Wings Dental, and you will see what other people have to say about the type of practice that we have, right? So that's my invitation to you. If you have found that this was valuable to you, please share it with other people. Share it with whoever you know. I just wanted to be vulnerable with you today, so you can go ahead and share it. Please like and subscribe to our channel or to our social media handles. And if you are around the place where we are Healing Wings Dental, and I'm Dr. Valerie Mukanga. So Healing Wings Dental, I call it the place where we help our patient maintain and or regain their oral health so that they can soar in life. We want to restore your smile as well so that you can regain your confidence. Remember, I told you that I lost the front tooth, so I understand what it's like, right? So yeah, so anyway, I just wanted to share that with you, and I wish you a great day. Oh, but before I do, our phone number, should you want to call us, it's 972-213-0202, and we are located at 4101 West Greenhouse Boulevard, suite number 317 in Arlington, Texas. Okay, so that being said, you have a fantastic rest of the day, and as usual, be blessed. Bye.